everybody believes that with chronic diseases, the best way to treat is as early as possible. But then the question is, what is early, right? I mean, okay, when there are symptoms, usually that means that the disease is already quite advanced. Once again, for instance, with chronic kidney disease, when you have a reduction of eGFR to below 60, that means that about 50% of the kidney is already not functioning, and most of that will never come back to function. Oh, we can still live with half a kidney, that's fine. But you realize that we're using the reservoir that we have. So early becomes when the pathology starts, not before, not when the symptoms start. But then the question is, well, are we going to treat everybody that has any sign of pathology to prevent this untoward development? And the answer is no, because first of all, once again, what are the risk factors for chronic kidney disease? Hypertension, diabetes. Well, first of all, we're treating hypertension and diabetes also because of the kidney, but also because of other organs. So why is the kidney most important here? To be discussed. I'm not saying yes, I'm not saying no. I think the crux of a good prognostic biomarker is, once again, it's able to identify a clinically meaningful deterioration and give the time frame for that. Now, the question is, should we be looking for a clinically meaningful deterioration due to a specific organ, i.e. kidney, or should we be looking for clinically important or clinically significant deterioration in the general healthcare, or maybe in, signs of frailty, for instance, because that is also a result of chronic diseases. So it is, I believe, prime time for that, for prognostics. It's just that it's also, there's a high need to be able to make the right definitions around prognostics. And that's when investors, when they will understand, when they will be on the same page in terms of those terms and the understanding of those terms, then it will be easier for them to start to intervene as well and be involved.